Good afternoon. I'm Dr. Sandra Martell, and I'm the Public Health Administrator for Winnebago County. And today I'm joined by Mayor Tom McNamara, Chairman Joe Shirelli of the Winnebago County, and Chief Carla Red. And we're calling this group together today to really kind of bring attention to all things COVID that are going on in our community. I think we've tried to talk to you about the numbers. We've talked a little bit more about what's going on, but today we really want to hit it home. Winnebago County is reporting 1,493 cases from Saturday through Monday. We are averaging close to 500 cases per day with an average age of 31 years. And unfortunately and sadly, we are reporting 5 additional deaths among residents ages 49 to 96 years. And our community mourns with their family. Hospitalizations have continued to increase. We saw a 15% increase just since December 31st. We are reporting 219 patients are in the hospital with COVID-19, and that's up from 187 patients just a week ago. 45 are in the ICU, and 11% of those in the ICU are on ventilators. And as of 8 o'clock this morning, we had 10 individuals that were what we call emergency department boarders, meaning they were waiting to be admitted. And there were only 2 ICU beds available in Rockford. We are at a very important, pivotal time in our community. Hospitals in our community are operating at what we call crisis standards of care, meaning that they are having to alter their routine procedures. They're having to adapt, prioritize, postpone, and staff have had to work even when COVID positive under the CDC guidance. So we are at a very critical time and we need our community's support. I've heard the numbers. I've heard said, well, people that are vaccinated get sick. That is true. We have seen people with infections that have been fully vaccinated, but the majority of individuals in our hospital, reported approximately 90%, are unvaccinated. And these are our local numbers. These are the numbers being reported not by a national news media or a state website. These are being reported by our local leaders, our community members, our neighbors, our friends, and our colleagues. Cases of Omicron have been detected, but it is not the predominant variant yet. And with these numbers, we're very concerned that when Omicron becomes the dominant variant, will there be room? Will we have the capacity to care for everyone who's needed? Children have been relatively spared, and unlike nationally, our percentage of children have remained stable at less than 5%. But I would argue that that's one percentage and many percentage points too high. So we're fighting the pandemic on 3 fronts in this community and as your health department. You'll be learning about how we're going to have to establish testing. We'd already been vaccinating, boosting for almost a year now, and we've been administering monoclonal antibodies. And to date, we've administered over 173 doses. And the reason we're in this room is because our usual conference room is being used as a treatment room. And we're running out of time because the Regen COVID that we're used in our clinic right now is not effective against Omicron. So once Omicron becomes the predominant variant, we're going to have to switch tactics. And the next line of drugs are those administered by IV. So they have to come through an infusion site. I know there's been a lot of discussion about the oral medications, things like Paxlovid, Molnupiravir, which are the last-ditch efforts. But those drugs have concerns. It's not that easy. They have many drug-drug interactions. They have to be taken within 5 days. And the effectiveness of the Molnupiravir is much lower than the monoclonal. So we are in a race against time, and we need the community's support. We've continued to vaccinate, which is our first line of defense, and we're breaking through those lines. We have vaccines that are safe, effective, and available. And booster doses are now recommended 5 months after completing the primary series, which is the 2 doses of Pfizer or Moderna, and 2 months after the Johnson & Johnson or Janssen COVID-19. And now we've had boosters approved for those individuals 12 years and above. And I keep hearing, well, they're not 100% effective. We do not yet have a vaccine in any area that's 100% effective. But these vaccines are highly effective at preventing hospitalizations and death. So what about our vaccination status? Where are we? So again, I want to commend our individuals 65 and older. 86% are fully vaccinated, but only 58% are boosted, so they are at risk. Individuals 18 to 64, 56% are fully vaccinated, and only 19% are boosted. Individuals 12 to 17 are 44% fully vaccinated, and of course they just became eligible for their boosting, so only 1%. And our individuals 5 to 11 are only 9% fully vaccinated. And when you look at the data that's related to our cases of COVID in our community, 8% of cases have had 3 doses or more. This is the boosted group. So the infection rate among this group is much lower. 64% of cases have not been vaccinated at all. So I ask you to do the math. I ask you to look at the numbers. It's time to get vaccination. It's time to boost it up. It's time to complete our series. It is our first line, and we have broken through our first line to our second line, which is the monoclonal, and we're quickly running out of time on our second line of defense. We also are announcing that Winnebago County, along with our school systems, will be following the CDC guidance. And I've heard people say it's confusing. What's called the 5 and 10. For those of you who remember the old days, we used to call them the 5 and dime stores. We're going to call it 5 and 10. We're hoping that it makes people easier to understand and, more importantly, easier to comply with. So we need you to stay and isolate for 5 days after you test positive. Day 0 is your date of your test, followed by 5 days of masking. This guidance is not applicable to long-term care facilities or congregate settings like the jails. And it becomes important to understand why the CDC is making this recommendation. One, we continue to learn more about the transmission of this. And as we did test to stay, for those of you who know the test to stay protocol was 1, 3, 5, and 7, where we tested children that had been exposed, and so we could monitor the development of infections. And we want to continue to support increased access to testing in our community. And we know that many people are, not only do we have these numbers that are being reported for our test sites, but we know that there's an increased access to at-home test kits. There was an estimate that something where there was 80,000 test kits sold alone in Illinois over the holidays for at-home through all of their various pharmacy partners and retail chains. We, from the start, have allocated our antigen testing systems and Binax Now test kits to our schools so that they could maintain in-person learning and again be able to what we call most protective, least restrictive method to keep children in school and staff safe. So if you test at home, I've heard this question, well, how am I going to know about it? You're right, I'm not going to know about it, but you need to do the right thing. If you test at home, what should you do? You stay at home and you isolate for 5 days. And then test before you come out of isolation as recommended, day 5, and then continue to wear a mask for 5 days. We know that these are effective strategies to reduce the risk. And we are going to work with our schools so that they can return children into the in-person learning environment safely with staff as well. So again, it should be fairly simple to follow. Everyone must isolate for 5 days and continue to mask for 10 days. If you're quarantined for fully vaccinated, boosted, you do not have to quarantine with the recommendation, but you have to be fully vaccinated and boosted. So now is the time to get those boosters. If you're unvaccinated, have an incomplete series, or unboosted, you must continue to quarantine for 5 days. Masking is still required for the entire quarantine, and testing is encouraged at day 5. So hopefully people get the idea that 5 is a special number that we should all be aiming for with the 10 days. We also announced changes to the contact tracing system in the state of Illinois that was announced last week by the state, and we reminded individuals. It is a centralized system, so people are getting text messages, and they are opting in to then be able to work with the state surge center. It's important that individuals recognize that this will be a 312 number. We announced it, it's been published, 312-777-1999. If you get a text message from this, please opt in. This is how individuals can get additional guidance regarding contact tracing, additional instructions. If you need a letter to return to work or school, this is where you'll be getting it from. Local health departments will continue to prioritize what we call higher risk cases. So we're very involved with our long-term care facilities, and many of them are having what we call outbreaks at this time. So you're seeing changes in guidance for them as well, and that impacts the residents of those communities who may not be able to see family members as frequently or have restrictions placed on them. We are doing other things like potential clusters and outbreaks, including the jail and schools, and we're working very closely with all of our schools. At this time, I want to be clear with everyone, though, that they have no transmission in the schools that has been reported to date. Do we have a lot of cases in schools coming from the community? Yes, we do, but we do not have documented transmission in the schools. So it becomes important to understand that schools and our workplaces, for many of us, are some of the safest versus being out in our own community. When you look at transmission rates, it becomes important to understand it's because school and work environments typically make us follow and adhere to guidance, whether it's masking, 6 feet of social distancing, testing strategies, but that's how they're keeping us safe. And I want to be clear that when you call the health department for a letter to clear you, we are not going to be the agency that provides that letter. That will be provided through the State Surge Center at 312. So again, we're really turning a different phase in the pandemic. We're not learning anything new about what techniques work or don't work. We know what works. If we are serious, if we want to protect our livelihoods, our businesses, our healthcare system, keep our children in school, we need to double down on our efforts. We need to stand up our first line of defense, vaccinations and boosting, get our treatment if it breaks through on that to our second line, and test if we develop symptoms. But it becomes important to understand that resources are not unlimited. We are hitting a very critical time where resources are very limited in our community. So if we're going to be serious about coming through this other side of the pandemic, not only just surviving, but thriving in the 815 region, we need to come together as a community. It is through our collective effort that we will get through this. And so with that, I'm going to turn it over to Mayor McNamara.
Thank you, Dr. Martell, and thank you. Sad to say that we're coming up on 2 years of dealing with this pandemic, and just want to say thank you, Dr. Martell, and your entire team here at the Health Department. No one in our community has worked more tirelessly than Dr. Martell and her team here at the Winnebago County Health Department. So thank you for your leadership and tireless efforts. Speaking of tired, I'm completely tired of talking about COVID-19. I think everyone at home is tired of hearing me talk about it or anyone else talk about it. But I have to tell you right now, our numbers are absolutely staggering. Our hospitals are completely full. Our healthcare workers are absolutely exhausted. There was actually a point when Dr. Martell and I would come up to these press conferences, and before we would talk about the numbers numbers, and we thought 160 cases were a lot. We thought 200 were pretty darn high, and 250 was just astronomical. And to hear the numbers that she just repeated, what was that, 1,400 over the weekend plus? And there was a day last week, I believe, that we had 1,200 cases in a single day. Folks, we can do better, and I think what Dr. Martell just closed with is that real sense of community. We saw a lot of that take place throughout this pandemic. We've seen just incredible acts of grace and humility and connectedness with our neighbors and our family members and our community. We've seen that, but we've also seen that come and go a little bit. We need to bring that back as a community and say we individually and collectively can do a lot better than what we're doing. It was just announced by Dr. Martell that 2 right now ICU beds are available in the city of Rockford. So if you think you've been boosted or you don't need it, you don't need the vaccine, well, let's just also hope that you're not in an accident. Let's just hope a loved one doesn't have a heart procedure that's needed immediately. Let's hope that you don't need any medical care, and nor do any of your loved ones. So I would strongly urge everyone, get vaccinated, get boosted, follow the very simple things that all of the professionals are telling us, from wearing a mask, practicing some distancing, washing your hands regularly, things we've learned in 3rd grade that show that you are not a selfish individual. So I'd urge everyone to help us participate in that. And, if you've gotten the vaccine, if you are boosted, urge some loved ones to get boosted. Have some heartfelt conversations about your experience when you got the vaccine or you got boosted. Share your experience, because some people probably are a little bit scared to get it, but share that experience that you had with them. I can tell you at the city, we're doing what we can to make sure that we keep our employees, their families, our customers, and citizens in our overall community safe. We are getting to the point, and it'll start tomorrow, that nearly all of our meetings will be going virtually. That means all of our committee meetings, all council meetings will have the opportunity for people to participate virtually. All of the other committees, liquor, tobacco, advisory, and so on. We're also canceling a lot of our non-essential meetings. That brings us back to the days that we did not like, of not having to have the opportunity to have neighborhood meetings and things of that nature. We're also really strongly urging individuals who can do their business with the city online to do their business with the city online. We want to, number one, make sure that we're protecting really both our citizens as well as our employees. So if you have issues that can be dealt with by phone or online, we're urging you to do that. I can also say that we as an organization are going to continue to do what we can to help slow the spread, but I'd say to all the business owners out there, please help us slow the spread. I know many of you are doing absolutely everything you can, and just to give some folks some ideas, provide your staff a paid time off to go get vaccinated. Make sure that you are allowing them time off when they're sick, so that they're not feeling like they need to be forced to come into work while they're sick, infecting other of your employees and your customers. It's obviously overall been an incredibly trying 2 years, and I think there's been some frustration on people's part when information changes, and all I would say to that is that's science. What we do is we learn and then we adapt, and if we learn something new, we adapt again. So it's not that things are changing because people want them to. It's because the science and the data are showing us what does work and what doesn't work. I again just want to say a huge thank you to the health department, to the county for their work. Last thing I would say before I turn it over is stop listening to the rumors. Start actually listening to, if you don't believe what's going on nationally, okay, internationally, okay. Dr. Martell is here to provide you accurate information from, as she said, our friends, our coworkers, our colleagues, our neighbors right here in our community in Winnebago County. They're telling you that there's 2 ICU beds. They're telling you that 90% of the people who are being hospitalized are not not vaccinated. Those are facts. That's what we're dealing with every single day. So please, don't be selfish. Start caring for yourself. Start caring for others. And with that, I have the opportunity to introduce Chairman Chiarelli. And I would just say, Chairman Chiarelli does an exceptional job as chairman, but he's also just a better person and a really wonderful friend to both me and Sarah. And him and his amazing wife, Connie, I can't imagine what they went through. What I can tell you, in talking to the chairman and talking to Connie, no one wants to go through what they've went through, and they're really fortunate. And Joe, I just want to say I'm happy that you're back and you're here with us, so thank you.
Thank you, Mayor. Thank you for those kind words. And I know my wife feels the same way. She's very happy I'm still with us. So I'm not at home with her. And thank you, Dr. Martell, for all the work the health department has been doing through this pandemic and continues to do to keep our community safe. I just want to start by saying, the recent numbers that are coming out concerning COVID-19 are alarming. It's an alarming rate that we've seen and will continue to see. It's overwhelming our community and our health systems. Even with increased testing capacity, it seems difficult to keep up with the demand. And of course, that increase in testing has led to more than a 20% positivity rate for COVID-19. That is one of the reasons why I proclaim Winnebago County a disaster area for COVID-19 response. It is alarming to me that as a private citizen, as a chairman, that I was unaware of certain treatments that could be provided to people who test positive for COVID-19. One example, when I first tested for COVID-19 on November 3rd, I was asymptomatic. On November 10th, I was fully paralyzed from my legs, my arm movement, difficulty breathing. I was coughing up blood. And if it wasn't for my wife, who found me on the bedroom floor, I probably would not be here today to speak of this. It's very important that I do speak of this. There were treatment opportunities available, and I was not aware of them. Speaking of the monoclonal antibodies, it was very clumsy, it was very difficult for me as a Winnebago County citizen to receive that antibody treatment. I was told I needed to go to Ottawa, Illinois to receive that treatment. Even though I was asymptomatic at the time and couldn't make that trip, I refused to make that trip. I'm a Winnebago County resident. Why do I need to go to Ottawa, Illinois to receive that treatment? I did not want to subject somebody taking me in a car for that long of a distance while I was positive for COVID. And when I did speak to my physician, my private physician, she was just as alarmed and upset and really got all over me in the exam room that I needed to change that in Winnebago County because she could not write an order for her patients without them going to Ottawa, Illinois to receive that antibody treatment, a first-line defense against COVID-19. She then told me I needed to get a Swedish-American doctor to write that order. Now, how clumsy is that? I'm an OSF, my doctor is with OSF, and now I need to contact a Swedish-American doctor to go. The antibody treatment, and guess what? It's in Boone County. I would have to travel to Boone County. Why couldn't Winnebago County residents get that antibody treatment as accessible in Winnebago County? So, having said that, if I had gotten that antibody while I was asymptomatic, I'm sure I would not have ended up in the hospital, paralyzed, coughing up blood, because other people that I was speaking to in those 7 days prior to being me admitted, telling them to go get it, they received it in Ottawa or at Boone County, and they were walking around in 2 days fine. But myself, I ended up in the hospital for 5 days on my back, begging for my life, because I had no advocate up in the COVID rooms. You are subjected to whatever they have to do to help you, and thank God for our doctors and our nurses who were full of anxiety and full of stress, that they were able to do their jobs to help me and others in that COVID-19 floor. This is another reason why I came out of that hospital and said, we need solutions to this problem, to help these healthcare systems reduce the burden that these employees and staffers are going through, reduce the amount of people in the emergency rooms. We have treatment opportunities. I call on all the physicians of Winnebago County and elsewhere to make treatments available and awareness to those treatments to their patients. We can no longer continue down this road. I see it three basic aspects of our response. For the hospitalizations, for the newly diagnosed that will benefit from early treatments, and of course the prevention aspect of it. We've been talking prevention since the beginning of the pandemic. But there are other options available that we need to, if it does get a breakthrough case. I was fully vaccinated. In fact, I had COVID-19 November of 2020. 3 weeks before the election, I had COVID-19. Then in February, I was fully vaccinated, right? But in November 3rd, I tested positive again. Please do what you need to do to protect yourself. Talk to your physicians. Get the information about the vaccine if you're hesitant. Get the information about early treatment. There are other antivirals coming out soon that hopefully our community will be getting. Right? And there's other antibody, hopefully soon, that we will also get from the federal government, the state government, especially for Omicron. You can now easily register for the monoclonal antibody treatment through the health department website. Please, if you test positive, go to that website, fill out the questionnaire, and I'm sure you'll get an appointment with the health department. I'm happy to see this process is going forward, and registering for an appointment is much more streamlined and easier than I had it on November 3rd. So, vaccination is also linked to reduced severity. So please consider the vaccine. Talk to your health care providers. Talk to an expert that you trust to make sure that you have all the available options at your disposal. If you have symptoms of a cold or flu, get tested. We have many testing sites available, as Dr. Martell has already said. And speak to your physician. We also talked about the point of contact, improving point of contact when you do test positive. What is somebody supposed to do? When I tested positive, they told me they would text me or email me, but nothing about what I was supposed to do from that point. I was asymptomatic. I didn't feel I needed to talk to a doctor, right? Because I wasn't sick. But as it progressed and time was running out, it goes from bad to ugly very quickly. And that's where our hospital system needs help. They're doing a fantastic job inside their hospitals. Fantastic job. I saw the stress, anxiety from the nurses and the doctors. They're doing what they need to do. But outside of the hospitals, in the clinics, please, for the physicians, give those treatments and give the people the opportunity for those treatments and make them aware of it. So again, I call on all the physicians in our community to be more proactive and informative about all the early treatment solutions and options available to their patients. Speed does matter. Early treatments work, and they do matter. All of our preventative measures matter. So as far as back to the disaster declaration, it was a coordinated response. My number one goal was to reduce the severity and save lives. That's why the Winnebago County Board ratified that declaration of disaster, for a coordinated response to help our community. And we will continue to do that. It does expire January 31st, and I will be asking the county board to extend that declaration on the advice from the health department. So, in closure, please, this is very serious. I saw many people, 3 people in the COVID unit that I was in pass away while I was there, right? They didn't have the opportunity that I have today to speak in front of you. Number one, take it serious and talk to your physician. If you do not have a physician, please call the health department. We have Crusader Health. You have opportunities to get medical care, right? We need to reduce the quality of our health care in this, or increase the quality of health care in this community, right? I was told I'm overweight. I was told I'm diabetic, but my blood sugars were controlled. Everybody, I believe, is a little overweight, right? So we need to lose more weight. Keep our blood sugars in check. Make sure your numbers are good. Take your vitamins. It's very important to have your vitamin supplements up to date and taking them religiously, because that will help save your life. I know that was one of the things that helped save my life. I call the vaccine a seatbelt. It didn't prevent the it didn't cause the accident, but it did prevent me from dying. That's very clear from the doctors I spoke to. I'm still going through the effects of COVID-19. I'm still under doctor's care. I need therapy. But we can make this a better community and a healthier community if we all work together and we all follow the advice, if not from me or Dr. Martell or the mayor. Call your physicians, talk to them, all right? Talk to your healthcare providers. I'm sure I missed quite a bit here, but what I would like to do is pass this on to Chief Carla Redd for her comments. Thank you.
Thank you. I'm a long way from being a medical physician or anything to do with medicine, so I'm one of those shared experience cases that the mayor did speak about. Dr. Martell, I want to thank you and your team for all of your effort, for your leadership in recognizing and placing the emphasis on how important it is to get vaccinated and recognizing the effects of COVID-19 in the community. Chairman, my story is a little different than yours. I was not vaccinated. I will tell you all that I came from a point of education. I wanted to educate myself before I did get vaccinated. But something that I wanted to share is that everyone needs to recognize that COVID has no respect of person. Does not care who you are, what you have to do, doesn't care anything about your family or anything else like that. I had a lot of stuff going on in my life at the time when I caught COVID in May of 2021, and I was waiting for the right opportunity to go get vaccinated. I had done all my research I felt I needed to do, and I was going to go get go get vaccinated. I had a busy weekend that weekend and was planning to go get vaccinated that upcoming week, and COVID took me down before then. I ended up being off work for 3 weeks. I'll tell you, when I was down sick, I lost a complete week. Luckily, I had family there and friends that were supporting me during this ordeal, because I'll tell you, there were times where I thought I was going to give up. I could literally see myself not being here. Wonder what life was going to be like for my kids without their mom, because that's how sick I was. There were days I could barely even get out of bed. So I can't even imagine someone being alone and having to go through that fight. Once I got over the stage of just sleeping constantly, it was almost as if something clicked in my body and I was unable to go to sleep. So we're talking about, I was probably close to 3 days with no sleep. And regardless of what I tried to do, I was unable to go to sleep. Calling my physician didn't help. They didn't want me in the office, of course, and I think with all the newness around COVID and physicians not quite sure what to do, because there's not a whole lot they can do, I think. It's a virus, it has to run its course. And my physician was scared to even tell me to take a Benadryl to try and help me sleep. So I tell you all, don't listen to the rumors. It was stated earlier. By all means, get educated. My education led to me being vaccinated, like I said. And just, I regret I didn't get vaccinated sooner. But since that time, my family is vaccinated, even my 17-year-old son. We're coming up on the time to get our boosters as well. Also, I can't say thank you enough to the medical staff that's out there day in and day out in the hospitals providing care. I have, my sister is in the medical field, I have other family members that are in the medical field, and I see the effects and the stress that it wears on them as well. And by all means, if you don't get vaccinated for yourself, think about your loved ones. Think about your mother, think about your grandmother. One of my friends just called me. His dad did not get vaccinated, went over to his mom's house. The aunt contracted COVID and she passed away. She passed away about a week ago. So, I mean, it's a larger picture. This thing is bigger than any one individual. Think about the others that you come in contact with and how it may affect them. You yourself may not have an underlying health condition, but you go visit mom and she's got an underlying health condition. So I'll just place emphasis on, what Dr. Martella said, what the mayor said as well. Rockford, we're better than this. We have to do better. We have to. The numbers are showing, it's critical at this point. So step up and do your part, everyone, please. Thank you.